So again, thank you so much, everybody, for joining. This is Sanket Barley from FigMD. We have a couple of folks from FigMD on the line, and I'm going to turn it over to Dr. Khan to make some introductory remarks, and then we will begin the presentation.
Thank you, Sanket. Well, welcome everyone to this webinar with FigMD. This is Norman Khan, Executive Vice President and CEO of the Council of Medical Specialty Societies. I think folks know that at CMSS, the development of registries is our current highest priority. We've had 2 registry summits, one in 2014, one in 2015, and a series of webinars we've done and planned, and this particular one with FigMD. One of the questions that comes up for us frequently, particularly from those societies that are in the process of planning a registry or building a new registry, is what vendor do I use? Do I do it myself? Do I hire someone else? And we've come to the recognition that FigMD has just a tremendous amount of experience in this particular area. So we asked FigMD if they would be willing to do a webinar to describe what it is that they have to offer as a registry vendor. A number of the societies that are members of the Council of Medical Specialty Societies are already using FigMD, so there's a lot of experience to be shared. So as a benefit to the member societies of CMSS, I'm happy to introduce Sanket Barale and his colleagues at FigMD to describe, in answer to the question, what does FigMD have to offer? Why should we consider you as a vendor? So take it away.
Dr. Khan, thank you so much for this opportunity, for enabling us to discuss our thoughts on this critical topic. I'm just going to go through some brief introductions. That's me and what I used to look like a couple months ago. We also have on the line Tim Parr, who is our VP of Technology, and we also have on the line Sidney Barley, who's the VP of Business Development. So I want to share with you our vision for the registry space and give you a flavor of why FigMD is doing what it's doing. We're focused on technology. We're a health IT company. We've been a health IT company for a very long time, using technology, helping that focused technology approach improve healthcare, various aspects of healthcare, including the quality of healthcare. Really excites us. That's what we strive to do every single day. So with that passion, we deliver breakthrough solutions in collection, measurement, analysis, and reporting. What that basically boils down to it, we make it very easy for the data to be collected, aggregated, measured, analyzed, and we consider our job well done. Folks using the registry products and solutions that we offer don't notice them. They need to be pervasive, yet hardly noticeable. They should just need to work and get the job done. We believe that very, very deeply. We've been around since '99 in health, working in health IT. We are providing the industry leading technology with the registry space. We've been focused exclusively on registries, building and scaling registries for you for the last 6 years. And we operate some of the largest clinical data registries in the country. Our platform, ONC certified, 2014 edition, and we will have 2015 certification very soon. This essentially enables any of the societies that are using FigMD to qualify as a QCDR and do the appropriate submissions for their members as a QCDR. So this is an ONC modular certification. Some of your colleagues that are already with us, that are leveraging FigMD's capabilities and deploying, scaling, migrating existing registries, etc. We're happy to say that we're enjoying a lot of trust and confidence from you. We're humbled by that, and we look forward to raising the bar higher. These are the folks that we are currently managing registries for. We have pioneered the interoperability with EHRs. We are the leading vendor, if not the only vendor out there that interoperates natively with 70 different EHR and their PM systems, and that list is growing. And what I mean by that is that, your participants do not need an interface from the EHR company or an HL7 feed or anything that they have to do in order to participate in a FigMD managed registry. They simply have to install a small piece of software that pulls the data directly out of any data source, any database, whether it's Epic Clarity or the next-gen NG Prod database. It doesn't matter. It pulls the data out, normalizes it, comparable apples to apples at the registry, and enables reporting. So by doing this, taking the complexity out of participation, we have really been able to help registry scale, and I'll share some of the numbers with you shortly here. What we wanted to do is discuss our thoughts in terms of what your registry should be. These are our perspectives. We're very passionate about taking these perspectives and offering products and services that achieve these objectives, if you will. And so I'm just going to run through them here with you shortly. Your registry should, in our opinion, be easy, and what we mean by that is easy to join and easy to use. It should be scalable, and what we mean by that is, it should be able to scale to handle large volumes of your members that would want to potentially participate in a short period of time. Should be able to handle a high data volume at a high fidelity. Enable capture of data across multiple care settings. It should be secure. It should be resilient from an infrastructure perspective. So that's scalability. It should also be valuable. The obvious value is clinical quality measurement, the feedback loop, and improvement. But it should also be able to support your research mission, as well as the research and discovery missions that your members may individually have. It should enable reporting to multiple external entities, including CMS. It should enable with compliance, and it should also enable engagement, whether it's patient engagement, point of care engagement, etc. And your registry should be yours. You own it. It's yours. It should be your brand. You need to essentially drive the narrative around the registry. The business model that the registry operates in should be yours. A vendor should not be forcing a business model and an operations model on you. It should be the other way around. We should be flexible to work with your needs. It should be sustainable. The expectation should be from the vendor that the vendor should participate in the sustainability effort and not just be an overhead. We believe, again, registries should be easy, scalable, valuable, and they should be yours. And I'm just going to go through and take each of these topics, just dive a bit more into depth with each of them. So let's talk about registries being easy. What we mean by that is that the sign-up process for your members should be easy. Specifically, the registry should implement a single sign-on. Most of your members already are engaged with your society or association, and they're already using a secure portal of some sort and interacting with your member-only sites of your website. There is no reason why the registry should impose an additional login password. It should be very seamless from an initial sign-up login perspective, as well as a subsequent authentication and use perspective. The registry should support e-contracting. Pretty much in every other walk of life, we're used to signing contracts electronically, and there shouldn't be any reason why we have to shuffle paper back and forth to accomplish that. It essentially accomplish that same objective within registries. So the user experience should be, click to sign up, fill in some basic information, are presented with a contract, you sign the contract online, or have somebody else in the practice or group be able to sign that contract electronically, and then further the participation process in the registry. When it comes to submissions, the submissions of data to the registry should be easy. So that means that we should be able to accept a diverse set of options. So, for example, data pull, which is what FigMD has pioneered. So giving your participants the ability to easily just deploy a small piece of software and then letting the registry or FigMD do the work and actually pull all the data out and not burdening them, your participants or your members rather, with that. Data push with vendors that are sort of cloud-based. Athena is a good example. The registry should be able to accept files or other standard or non-standard data feeds that would come from vendors. The registry should be able to support a robust web-based data entry portal. It should be able to support paper submissions. And these paper submissions may be in the form of actual case forms, or there may be patient surveys or whatever. But you really need to have the opportunity for somebody to be able to submit a piece of paper to you. And this is we understand this is going away, and there's a very, very sub 1% of the population that FigMD manages and engages from a participant perspective that actually uses this. But it's something that until everybody transitions, you should at least consider keeping it open. The submissions need to be broad in terms of being able to accept clinical data, administrative data, and any other data that is relevant to the scope of your registry, as well as is within the needs of the participants. And we want to be make sure that all of these options are available and are easy to use and deploy. The user experience should be modern, it should be fresh, it should be pervasive. If the participant wants to consume the data or interact with the registry via the web, they should be able to do that. If they wanted to do that via a mobile device, they should be able to do that as well. Talking about scalability for just a few minutes. On the participation side, registries should be able to scale up to more than 80% member adoption within 3 years. Now, that's a metric for the capability of the registry, not necessarily bottom line in terms of how you push the registry adoption, but the registry should be, in our opinion, be able to scale that quickly. Should be able to handle volumes of data, millions of patients, hundreds of millions of visits, billions of data points. While scaling both on the participation and the data volume side, quality should be focused. There should be provisions for automated data quality reviews, as well as a robust quality evaluation process that ensures a high data fidelity along with scale. Should be longitudinal. As I mentioned earlier, the registry should have the capability of capturing data from multiple care settings, whether it's an outpatient setting, when the doctor transitions to an inpatient setting, be able to interface with those systems, or they go to a surgery center, essentially be able to offer a longitudinal data collection methodology which spans across multiple settings, across multiple data capture mechanisms. So maybe some of the data is being pulled out of an EHR, maybe some of it's being pushed from a hospital system, maybe some of it's being put in via web form at an ambulatory surgery center. All of those need to be coupled together into a single record and then analyzed and reported on. Clearly, it needs to be secure. HIPAA high-tech compliance is a basic need, but on top of that, again, strong encryption all the way around. So something that's double what is standard as far as financial transactions are concerned is a minimum. What we mean by that is you want to have the PII stored physically and logically separate than the rest of the data, and have separate encryption protocols, access restrictions, audits, various other infrastructure-related safeguards in place to guard that information. And the registry organization, which includes you and FigMD, both need to have a very vigilant approach towards security. Some of it's systems-driven, a lot of it's process-driven. We need to be eating, drinking, sleeping, vigilance on security. It needs to be resilient. The nature of the registries are changing. Registries, half a decade ago used to be data collection via web forms and monthly reporting, quarterly reporting. And with those systems, maybe if they were up and down here or there, it maybe didn't matter. But increasingly, the registries that we're building are becoming sort of always on, access anytime, driving point of care quality interventions. When you get to the point of care and feeding this data in near real time to to providers, you absolutely must have it always on. It should be structured in a distributed fashion where it's load balanced and it's fault tolerant and it spans across multiple physical data centers, speaking to the resilience as a part of the scalability. So I want to share a couple of numbers with you in terms of the scalability that we have been able to achieve. So this is the growth curve of the Pinnacle Registry for the American College of Cardiology. This registry was launched late 2009, early 2010. This is really where we started our pioneering work as far as the EHR interoperability is concerned. As you can see, just in the last year, the registry has gone from 15 million to 21 million patient visits, covering over 5.3 million unique patients. This covers a whole slew of comorbid conditions and data points. If you're interested, you can definitely browse the ACC's website for the Pinnacle Registry and understand. In addition to this, recently we've assisted the ACC in launching a diabetes collaborative that expands the scope of their outpatient registry work. Another point of scalability, rather, would be the IRIS registry. So IRIS formally launched in late 2014 at the annual meeting and has seen tremendous growth since then. There's just over 7,000 physicians participating in the registry at this point, and it's growing exponentially. As you can see, it went from 0 to 36 million in just a year, with over 11 million patients. And this is for the sake of clarity, this is the entire ophthalmic database with all conditions, and it's very deep, the data that's contained within the IRIS registry. Transitioning to valuable. Clearly, the registry needs to demonstrate immediate and long-term value, both to you guys as well as your members. And what we mean by that is, clearly the quality measurement is one piece of it. Process measurement, outcome measurement, being able to deliver benchmarks at a national, regional level, is critical, and need to be able to implement and score risk-adjusted measures. The research and development aspect of the value chain. So, in addition to quality measurements, registry should be able to support analytics, be able to enable you guys to perform observational research, give you insight into guideline development and modifications and measure developments. It should be enabling the measure authoring and life cycle process. So this concept is where you're actually using the registry platform to author measures, simulate them based on the population of data that you have in the registry before you release the measure in the wild. It should enable reporting. Here's the alphabet soup. So there's the demands on reporting of this data on your members is escalating substantially. And regardless of the program or the format, the registry platform should be able to assist in that reporting. Should enable compliance with MOC and other requirements. And it should be a tool for engaging the patient at the point of care, multiple avenues. We believe registries shouldn't just be data collection endeavors which are passive. The opportunity here is to take all the wealth of information that's in the data that you were collecting and feed it back to the patients as a part of experience of care, doing pre-op, post-op surveys and plugging that into the quality measurement, both at the registry level as well as empowering your members and their groups with tools to do that independently if they wanted to, do an experience of care initiative. The registry should be able to feed quality action recommendations at the point of care. It's great that we can look in the past and see where the numerators and denominators were a week later, a month later, but how about if we're able to pre-qualify patients for certain denominators based on their clinical history and just show that to the provider at the point of care, make that quality intervention active instead of passive. And we should be able to support administrative simplification. So participants should be able to interact with their data, do cohort modeling, outreach for patients, various other activities through the registry platform. Quickly about the fourth quadrant here, we believe the registry should be yours. You should own it. You own the data, you own the measures, the data dictionary. it's basically yours. It shouldn't be any other way. The brand should be yours. Your registry should not be in partnership with or powered by or something else. We believe your brands are extremely powerful, and your members acknowledge that clearly, that they should be protected. Again, the business model should be yours and not what a vendor chooses to operate under. And so the vendor should have the ability to be flexible to your needs. And as I said earlier, it should be sustainable. What I mean by this is that we should be able to support you in making the registry financially sustainable. Again, as Dr. Khan said, registries they were nice to haves about a half a decade ago, and with all the reforms and the value-based payment shifts of the healthcare, they've essentially become a need for your members and to help members remain competitive in their clinical practice and viable. As more organizations acknowledge that and recognize that, scale up their registry initiatives, we're more than happy to engage in the conversation and participate in helping you solve a critical challenge for your members. Reach out to us if you just want to have a conversation, and we look forward to engaging with you all in the near future.